Hello friends, how are you? I hope you have seen my previous three videos. In previous videos in part 1, I have discussed about the normal ECG strip and normal duration of all PQRS T waves. In part 2nd, I have discussed about the ECG leads relation to heart and axis deviation. In part 3, I have discussed about the various heart blocks. I hope you have seen my previous three videos. If you have not seen, please go and watch. It will be helpful. In this coming today's lecture series, part 4, I am discussing about the bundle branch blocks, left and right bundle branch blocks. Before going towards the lecture, I hope you have seen, I hope you will remember. If you not remember, I will recall a very quick what you will do after taking ECG strip in your hand. Number one, go for the standardization, look for the standardization. Number second, check for the heart rate. How you will check? Go towards lead second, check the duration of RR interval and divide by 300. Now what you will see third, you will see axis deviation. Axis deviation in which leads you will see lead first and lead AVF. Then you will look for the P wave, normal height and normal width. I hope if you remember these values, normal height of P wave is it should be less than 2.5 mm and its width is less than 0.12 seconds or 3 small square. It should be less than this. Then go for the ST segment in limb leads, check in that. Then go for look for the Q wave in V5 V6 which is normally present. Look for the T wave which is less than 5 mm in limb leads and less than 10 mm in chest leads. These are the frequencies. At least you will check for these all values. Then look for the abnormalities. I have discussed in lecture series part 2nd and 3rd about the abnormalities. In today's 4th lecture, I am going towards the bundle branch blocks. So what you understand by bundle branch blocks? Bundle branch blocks, you see the conduction of the heart. The normal conduction of heart from the bundle of his is like this. Vector goes towards from left to right. And if you can appreciate this is lead V5 V6. I am talking about the normal, and the chest leads V1 and V2 comes here. So when current goes away from somewhere, then it's negative vector. I hope this is mathematical. You can remember this. This is the reason we find negative Q wave in lead V5 V6 because the conduction goes from this direction. Okay, now coming towards the bundle branch blocks. In bundle branch blocks, I hope I can made like this. But right left bundle branch blocks and right bundle branch block. I will make a very nutshell. In bundle branch block, in left bundle branch block, there is some abnormalities. There is a damage of this on this part of conduction. So in the vector also changes in the it's coming from right to left. So what will happen? First thing, there will be no Q wave in lead V5 and lead V6. I am telling you just points, short points that you can easily recognize. And if so, normally the conduction passes and it takes like this. So the duration of QRS complex will also be more than 0.12 seconds or more than 3 mm. This is the duration of QRS complex increase in both left and Right also QRS duration is also increased 0.12 seconds. In this, what you will see the deep S wave, or you can say the tricky word in lead V1. You will see in V6, you will see M pattern. You can appreciate this looks like a W. In you will see like this V6. So there is a small trick also, we call that William. Okay, you can go through this trick and you can appreciate in lead V1 and V6 the W the W and M pattern. W and M pattern. I will write down the small criterias for this. There should be a criteria for everything. So first criteria, there will be a broad QRS more than 0.12 second. Then there should be a dominant S wave in V1. So this dominant S wave in V1, it will make a V1 pattern. Then and then there is a broad R wave. Yeah, broad R wave in lead V6. So broad R wave or R pattern. So you can appreciate like this. This is the William pattern, and usually you will see left axis deviation in these patients, and and you can often confused between MI or left axis deviation. So to differentiate between these two, there is a called a one criteria, Sagar-Bosa criteria. Sagar-Bosa criteria. We need not to go in detail about this Sagar-Bosa criteria, but we must know that at least one name to differentiate between the MI and left axis deviation. So going towards the causes, what causes a left axis deviation? And if you know, left axis deviation is more dangerous because left ventricle is not synchronizingly beating, so then can lead to a pooling of blood and cause pulmonary embolism and many other disease. The causes is, the number one cause is not number one, was just pointing towards the, we will go to important 6 causes to remember. We can say aortic stenosis, we can see, then there is the anterior wall MI, then maybe from decoxing toxicity, maybe dilated cardiomyopathy in hypertension or hyperkalemia. Okay, these are the causes, and there are the in V1 you will find the W pattern, and V6 you find the M pattern, broad dominant S wave in V1, broad R and R complex and left axis deviation. Now coming towards the left axis deviation we have completed. Now coming towards the right axis deviation. In right axis deviation, the current follows the same pattern as normal from left to right. There is a conduction like this, so of course there is a delay in, so this so there is a delay in conduction, so QRS is more than 2. This is common in this. In this right bundle you will find a, in left we found the M pattern in V1. Here we will find the rabbit leg RSR pattern in lead V1, and there will be in V6 also we find this kind of pattern. in lead V1 and lead V6 we find this pattern. So everyone has criteria. We have discussed the criteria of this. Left bundle criteria for right bundle branch block, wide QRX more than 0.12 or 3 small square, RSR pattern on V wave, broad and slurred S wave in lead first and V6. This we are calling a slurred S wave or like this. So these are the criteria for the diagnosis of the right bundle branch block. And now we will go towards the causes, as we have studied the causes of left bundle branch block. It's also some causes. The cause, what you can see, is right ventricular hypertrophy, pulmonary embolism, core pulmonale, ischemic heart disease, rheumatic heart disease, and cardiomyopathies. I hope you can appreciate the difference between these two. The causes, the trick in nutshell, if you want to go in nutshell, I have discussed about this. William and Marrow, V1 and V6. And one thing, remember, the heart, the duration of QRS complex is more than 0.12 seconds in both, and you will observe the changes in this videos in these ECG strips. I hope you understand, and if you go towards some ECG strips, you can really appreciate about these changes, and you can remember these causes. Whenever you read about this hypertension, diabetes, cardiomyopathy, just go look for the ECG, and maybe you can find these heart blocks. The right axis deviation is not that much serious, but left bundle branch is very serious and can mimic the interval MI, or maybe they will be correlation. Those patients having left bundle branch block, they have a chance of the MI. Thank you for watching this.